I'm going to introduce our next speaker, who is Professor Margaret Fry, who's come to speak to us today about tapping into innovation and advanced nursing practice. Professor Fry is a researcher, clinician, supervisor and teacher in emergency care and advanced nursing practice, and much of her work has actually led to significant change on national emergency practice policy and the quality and safety of nursing care. Professor Fry is currently Director of Research and Practice Development and Nursing and Midwifery Directorate of Northern Sydney Local Health District, and holds a conjoint professor's appointment with the University of Sydney and is an adjunct professor with the University of Technology, Sydney. So please join me in welcoming Professor Fry to the podium. Thank you.
I'd just also like to acknowledge the opportunity to come and speak to critical care nurses. In my very distant past, I had the privilege of working at times beside some of you when I originally was hospital trained in a double certificate, which was in ICU at St Vincent's in Sydney. So some of my fondest memories are, from that intensive care unit. But I moved on and have just gone on to do other things. But I think it's a tough gig to segue into this topic area from the gut and the microbiome. But I'll see how I can do that. The topic today that I was sort of asked to speak about was really around tapping into innovation and advanced practice. And as a nurse practitioner, and having introduced nurse practitioners into St George Emergency Department in Sydney, it was a challenging time and an interesting time, and I'm really pleased to see even in your own program there's a nurse practitioner. The neonatal nurse practitioners are very strong in sort of critical care areas, and I'll talk a little bit about the progress and where we see our world. But I guess it is, of all the disciplines, I think intensive care and critical care nurses have the longest tradition about extending practice and advanced practice. And every day you do make a difference, and you've transformed the landscape of critical care services. And some of you in this room are doing that today, and some hopefully will do it into the future and leave a legacy of change that we all have to be accountable for. So the topic really that I sort of want to start with then is really about embracing innovation, but more importantly, embracing the future. Often when we are all exposed to the changes and restructuring within our healthcare systems, we do get that fatigue, but I think it is the responsibility, and we need to be held accountable, as many of you are the leaders within your systems, that it is so important to be able to champion innovation, to champion new models of care, to champion advanced practice roles. And I think that it is about really, when we think about, there's, from your own databases, there's over 4,200 critical care nurses, and there's 280 intensivists. And so you are the very fabric and glue that shapes and keeps the critical care services together. So I think it's really important that we acknowledge that, but also then it really becomes about how do we change it. The Institute of Medicine, and I would suggest if you don't know this website that it's worth Googling and just going and visiting. This is really a non-government organisation based in the US. It was actually started around Abraham Lincoln's time, so it has a long history of being an advisory to the governments of the US.